Now, I'm going to give it to you in layman's terms, and then I'm going to let Robert, our clinical expert, speak at a little higher level. This is single layer amnion product. It's made from the inside of a placenta. This product is more pliable than other products out there. Most products are like plastic. They're hard to put into the wound bed. This product fits in like tissue paper, and it's to a perfect amount of stickiness. I know that kind of sounds funny, but it sticks into the wound bed. Other products are slimy, so they slide all out. They have to be sutured in or actually stapled in. This product does not. This product also has neutral placement. So kind of think about it like your cell phone, right? The shiny part goes to your ear, right? You don't want to put this part. It won't work as well. I'm going to ask Robert. Robert, could you give us a little more color on the
Sure,
placenta? Thank you.
sure. Appreciate everybody being here and learning. The whole point behind this is to save limbs and save lives here. It is about a product, but this product's doing some wonderful things out there. My name is Robert Lang. I've been in the wound care space for 25 years. I used to manufacture collagen dressings and probably about 7 different types of dressings in the wound care space. Then I went into wound care education to train the doctors and nurses and get them certified in wound care so they don't get into lawsuits or cause harm to patients. And what Vinny's talking about is a single layered amniotic dressing that is sourced ethically here in the United States. It's all made in the Arizona area, which is very important as he was talking about. The technology that Jacob brought along and tweaked this product with, he's actually done what they call cross-linking the collagen and the growth factors. And as Vinny said, this is the inner lining of the placenta. The placenta is what wraps around the baby and holds all that fluid when a woman's water breaks. It holds all that in there, and it's full of all kinds of growth factors and collagens and things like that, things that promote wound healing. And so with this dressing, staying in the wound bed for 7 days, you're allowing all these growth factors and collagens to really help the wound heal at an incredible rate with far less scarring. And it has anti-inflammatory and antimicrobial properties naturally to it. Anti-inflammatory, you guys know what inflammation is. It's pain. And it also stops the wound from healing. So if we can control the inflammation, we can help speed up the wound healing and take pain away from the patient. And antimicrobial means it knocks the bacterias down so we don't get an infection. And keeping that dressing in the wound all the time is less chance of an infection. Infections lead to amputations. Amputations can lead to death. Infections can lead to death on their own too. The product can stay in place, like Vinny said, 7 days, even 8 days, and we're in the middle of a huge 500 patient study right now to even show that. It's neutral placement, like he was saying. Any way you can place the dressing, any way you want into the wound bed itself. All your other dressings out there, there is a specific right and wrong way to place the dressing. That's going to help the doctor when they're seeing multiple patients a day. Okay, very easy to use for the provider. It can be stored up to 5 years at the doctor's office at room temperature, just in a cupboard itself if they wanted to. Most of the other products, you need a special type of a refrigerator or a freezer. It costs them money and it has to stay cold. Ours does not. So it's, again, easier for the providers to use. It comes in 5 simple sizes and shapes, and they're the sizes of most of the wounds that we see out there. Other products have up to 20 different sizes. And when a doctor's doing notes, and notes are very, very important when we're using these types of dressings. So if they're putting the wrong sizes down in their notes, they may not get reimbursed for it. And it's a very expensive dressing. So they have to show that the wound is actually making progress and getting smaller. And if they're messing with different wound sizes, that can cause an issue for them. It is reimbursed by Medicare, Medicaid, Medi-Cal, TRICARE, and most of your Advantage programs. For diabetic foot ulcers, the big holes you see in the bottom of people's feet, vascular ulcers, the big holes you see in the sides of the legs and the insides of the legs, pressure injuries, also known as bed sores. You see that a lot in the nursing homes and skilled facilities and hospitals. Burns, Mohs surgery, where they're pulling the skin off, removing skin, and it's all over the body, not just on the face. And that's big for dermatology. And then surgeries. They can be used in a lot of different types of surgeries. But surgeries that have gone bad and they're starting to open up where they sewed you up or glued you closed, those are called dehiscents. They can use it immediately on there, and it's going to help heal faster, keep the infection under control, and give it better tensile strength so it's not going to happen again later. All this stuff I've just said, you don't need to know a whole lot about it. I'm your clinical person. You can get me on the phone with your clients, and I will help talk to the doctor and talk about the drainage and the infections and debriding the wounds and different things like that. You just need to know that it's a single layer amniotic dressing that's going to help people heal, and then bring Vinny and myself and the team in to talk with your clients. So my name's Robert Lang. I'm here. Reach out anytime you need to, and I'm here to help you guys at a clinical level.